How do mental health professionals actually diagnose disorders? All psychotherapists and psychiatrists have to use the authoritative handbook called Diagnostic and Statistical Manual of Mental Disorders, known as DSM, to diagnose their patients. The first DSM was published in 1952 and included 106 disorders. When DSM-3 came out in 1980, it identified around 265 disorders. The latest version of DSM, DSM-5, has around 297 disorders. That means there has been a consistent increase in the number of disorders identified by DSM since it first came out in 1952. Alan Francis, who chaired the DSM-4 task force back in the day, discusses this increased medicalization of mental well-being in his book. According to this book, Alan Francis attended an event in 2009 where the members of the American Psychiatric Association were proposing new disorders for inclusion for the upcoming DSM-5. He soon discovered that he was personally qualified for many of the new disorders that were being suggested by his fellow psychiatrists. My gorging on the delectable shrimp and ribs was binge eating disorder. My forgetting names and faces would be covered by minor neurocognitive disorder. My worries and sadness were going to be mixed anxiety/depressive disorder. My well-known hyperactivity and distractibility were clear signs of adult attention deficit disorder. An hour of amiable chatting with old friends, and I had already acquired 5 new DSM diagnoses. And let's not forget my 6-year-old identical twin grandsons. Their temper tantrums were no longer just annoying. They had temper dysregulation disorder. The description of each DSM disorder is accompanied by a criteria set that lists in fairly precise terms which symptoms define it, how many must be present, and their required duration. For example, ADHD is defined as 6 or more symptoms that persist at least 6 months before age 12 years, present in 2 or more settings, clearly interfere with social and academic functioning, cannot be attributable to another disorder. That means a 10-year-old is not diagnosed with ADHD if he or she has fewer than 6 symptoms. The symptoms are present for less than 6 months. The symptoms are present in only one setting. The symptoms do not clearly impact academic and social activities. The question is, how can a mental health expert determine whether a patient's symptoms satisfy all the criteria required by an ADHD diagnosis or not? It is basically a judgment call made by the expert, who has to decide whether to give a DSM disorder diagnosis or not, based on the external behavior of the patient as it is reported to them. Unlike other fields, there is no laboratory test in a psychological evaluation. You cannot use biopsy to diagnose a mental disorder like you diagnose cancer, for example, where you remove a cell sample from your body and test it in the lab to detect cancer. Or, in the case of infection, you take a body fluid sample and test it in the lab to detect virus or bacteria. But in psychology, you cannot open up people's heads and look inside their brains and detect mental disorder. The diagnosis is totally a judgment call made by the expert. And to make this judgment call, the expert has to rely on external behavior that is either reported or observed. These reports and observations are, in and of themselves, subjective. Psychological evaluations do involve tests, but these are not objective tests like biological tests. Psychological tests assign scores to the external behavior that is reported and cannot directly measure the disorder that it is supposed to measure. The expert must know the patient to make sense of the reports and scores on the external behavior. That is why Hippocrates said that it is more important to know what sort of person has a disease than to know what sort of disease a person has. But in almost all cases, the expert does not know the patient and makes a judgment call in a vacuum, based on the said symptoms and on the psychological test scores. Like other medical enterprises, mental health care operates like an assembly line. You come in, the expert superficially assesses you, diagnoses you based on a checklist, then writes a prescription drug, lets you go, lets the next patient in, the cog of the medical enterprise turns, and the cycle of mass production continues. Finally, parents agree to get their kids on ADHD medication because they are told the medication would help their children to learn better. But research suggests otherwise. ADHD medication is not effective at improving learning. It is effective at controlling behavior. When you have children who are a bit fidgety, who find it difficult to focus on boring academic tasks in a sedentary environment after eating ultra-processed food, putting them on medication makes them easier to control. That's all. In that sense, ADHD medication is a bad teacher's best friend.